In this video, I'm going to talk about an important subject, that is diabetes mellitus. We all know what diabetes is. Can somebody develop erectile dysfunction as a result of diabetes? Or if that person has diabetes, can that person go on to develop erectile dysfunction as a complication of diabetes? The answer is yes. But what is the reason? Why is that so? What is diabetes mellitus? Basically, diabetes mellitus is an absolute or a relative lack of insulin. What is insulin? Insulin is a hormone that is secreted by our pancreas. What happens when the hormone is lacking or is relatively lacking? The body cannot metabolize glucose properly, so the glucose concentration in the blood goes up, and then glucose will also leak in urine. So by testing urine, we can find out if there is glucose in the urine. Now we can also test for this increase in glucose amounts in the blood. But what happens in diabetes? What is the pathology? What happens to the body? Diabetes can affect almost all the organs in our body. An important area that I like to talk about is what is called peripheral neuropathy. You might have heard this term. What is peripheral neuropathy? Peripheral, the meaning of peripheral is in the extremities. For example, in the leg. The toes are in the extremities, so that's the periphery. Neuropathy. What is neuropathy? Neuropathy basically is a disability of the nerves. So disability of the nerves in the periphery. Now you might have heard that people with diabetes can develop ulcers in the legs. Now one reason for this, of course, is inability to feel or the loss of sensations in the extremity of the leg. So you can develop ulcers or wounds, and it's difficult to treat them. They don't heal that easily, and it can take time. So that's an example of a peripheral neuropathy. But are there nerves in the penis? Of course there are. So can somebody have a disability of the nerves or problem of nerves in the penis? Yes, that person can have. Any person can have if there is diabetes and the nerves are affected. So when there is peripheral neuropathy and when somebody is suffering from erectile dysfunction, what can be done? Surely diabetes needs to be treated properly and looked after properly, managed properly. Are there other treatments that can be carried out for erectile dysfunction or impotence? Yes, there are certain other treatments that can be carried out to alleviate this problem so that the person can obtain natural erection. So that is the message of this video, that even if you have diabetes and have erectile dysfunction, it is a condition that can be treated and the erectile dysfunction can be reversed.